What's up, good people? My today's video is to help people who are suffering with a condition called retinitis pigmentosa, or those who have some dystrophies of their retina that's leading to the blindness, and that's also leading to a low vision problem if it's not complete blindness. That's the thing I am targeting today, and it's a good news for those people who are getting affected by retinitis pigmentosa and other hereditary problems in which the genes are affected, and that kind of genetic mutation leads to blindness, because that genetic mutation, for example, RPE65 gene mutation, can lead to retinal dystrophy, and that retinal dystrophy can lead to blindness. And we are coming up with more and more advancement, and we do have a hope of something called gene therapy. And that's what's it in the news, that's what in here, that there is a potential that the gene therapy can help you slow down the progression of the problem and help you recover to a certain extent, not 100% though. So children with this kind of rare inherited retinal disorder, they are treated in this study with the first FDA approved gene therapy. That's a big milestone in the history of mankind, that there is a gene therapy for blind people from genetic problems that we are coming up with. And according to this study, they treated 6 patients and they got good results. The patients all had an inherited retinal dystrophy that was caused by a mutation of this specific gene. So the thing is, if you don't have this specific gene mutation, you might not get benefit. So you have to talk to your doctor. You have to talk to your gene specialist or geneticist, that what kind of genetic mutation do you have that's leading to the blindness in your eyes, and you want to target that specific gene. And this is the first ocular gene therapy that's hitting specifically to this specific gene, because that's the most common gene that's leading to the blindness. And FDA approved it, and it was Luxturna, and that was in 2019, and that was followed by European Commission a year later as well. So it's claiming that the first gene therapy approved for a genetic disease, and the first adenovirus or adeno-associated virus, the vector gene therapy, was approved in USA, and that gave some good results. But still, we need to follow up on that. We need to follow up on those patients, because we are still in really early stages. And what they found out, that they observed significant improvement in the best corrected visual acuity, and no significant change in the central foveal retinal thickness, and no significant change in the central foveal outer nuclear layer. These are the areas of the retina that are extremely important. But the good news is they got good improvement in your vision, and that's what we want. So the best corrected visual acuity began improving at day 30 to 45. Isn't that a huge thing? So you got the results within a month or a little over that. That's amazing. And you saw more improvements in 6 months or so, like 180 days. That is amazing. And this is the kind of chart they use, ETDRS. And that's a huge thing. So gene therapy is a game changer. It's a phenomenal idea, because you have a genetic problem, and we are treating a genetic problem with the gene therapy. We are injecting, we are giving you a specific vector. It's a virus that's used as a transporting agent for that specific gene, and it attacks that particular area in the back of your eye and prevents the progression of blindness. So earlier you treat, the better. That's my viewpoint, and we are getting good results. So I'm just here to bring awareness, so that you can go and talk to your doctor, that you could be a good candidate for this kind of management. And it's been there since 2017. But I've been talking to a lot of retinitis pigmentosa patients or RP patients. They don't even know about this thing. So I am so sad that nobody even talked to them. And it's been 5 years. And we are coming up with more and more advancements. So who knows, by now, there will be even more, even though this paper just came very, very recently. So the, the results are right in front of you. I am not even just narrating from my own tongue. I'm showing it to you on the screen. And you can even take the picture shots of or the screenshots of this and go and talk to your doctor, because we are trying to improve the thickness of the retina as well, the layers that I was mentioning, the outer nuclear layer thickness, and that's the next step of the treatment. And analyzing the relationship between the best corrective VA, the visual acuity gain, and the change in the outer nuclear layer at the 6 month time point compared to baseline, they did observe that a higher improvement in BCA was significantly associated with the higher increase in this layer, the ONL layer or outer nuclear layer. And that's why we saw the beneficial results. And that's what we want, because we don't want the progression of the disease to a point called fovea that controls 99% of your vision. So, important thing is go to your doctor and talk about this, because these findings suggest that the treatment with VN halts the photoreceptor degeneration. That's what happens in retinitis pigmentosa. Your photoreceptors, what it means by photoreceptor is basically an antenna in the back of your eye. Just like you have an antenna that catches the signals and gives you that thing that you watch on the TV. Just like that, you have an antenna called photoreceptor in the back of your eye, in your retina, and that's what's affected in the genetic mutation of these people who go blind from it. And we are trying to halt or stop the progression of that photoreceptor damage. And that's through this gene therapy. And that's what we are seeing, the recovery, even though it's a partial recovery of the retinal morphology, but we are getting a good improvement in the best corrected visual acuity. More research will come, more content will come. Please stay tuned. Ask me if you have any questions in the comment section. And again, like, subscribe, and share, and spread the awareness. Thank you so much. Have a great day. Bye.